Hello and welcome to Kahali. And I'm delighted to be joined by Dr. Abdul Ghafur. As you can tell, he's sitting in nice warm Chennai while I'm bundled up. So goes to show, how the weather impacts everything from the way we dress to the experiences we have. But that's one thing that ignores weather and geography and people and class and caste and everything, and that's COVID. So, Doctor, thank you so much. We're back again to talk about COVID. And this time around, we're in a very uncertain place, aren't we, with what's happening in China? Because we don't really know what's happening in China. So, for our viewers, could you please just break it down for us?
Yeah, we are all concerned about what's happening in China, and our country is preparing for any eventualities. At the same time, we are not expecting, at the beginning of the show itself, I would like to say, we are not expecting any massive wave in the country, but it's always better to be prepared. So, our country is stepping up the preparation. We are well prepared, even if a wave happens. It's very unlikely that we'll experience any significant wave because of the Chinese situation, but it's always better to be prepared. It's always better to be cautious. Now, what has happened in China? Unlike most other countries, China, since the beginning of the pandemic, followed a zero COVID strategy. Extreme lockdowns, like we did in the beginning of the pandemic for a few months, China has been following a similar strategy for 3 years. Very strict contact tracing. If one person in a family is positive, the rest of the family will be quarantined, not just at home, in quarantine centers. They have been admitting even patients with no symptoms. We did that in the first few months of the pandemic. You remember? China has been doing that for 3 years. Even without symptoms, they admit you in a COVID ward for 3 years. Compulsory quarantine centers, compulsory hospitalization, compulsory testing, travel restriction. One of the amusement park in China, one person became COVID positive. Hundreds of people were quarantined in that amusement park. Nobody could get out. This happened a few months ago. That is called as very strict zero COVID policy. And then what happened? Majority of the COVID Chinese were not exposed to the virus. They had no immunity. And not only that, because of the forcible enforcement of the zero COVID policy, the people were rebellious. China faced the most extensive rebellion by the people after the Tiananmen Square incident. We all saw the video of the people on the street rebelling against the mighty Xi Chinese president. Unbelievable, unthinkable happened on the streets of China. And what did Xi do? He just opened up the COVID policy. He stopped the zero COVID policy overnight with no preparation. We're all surprised. No preparation. He just opened up. That's what China is facing. No immunity because of the low immunity. I will not say no immunity. Low immunity because of zero COVID strategy. Lack of preparation by the government, and overnight changing from a zero COVID strategy to no strategy. Absolutely no strategy. No testing. No reporting. No quarantine. Just hospitalization of very sick patients. Every day we believe millions of people are getting infected in China. Official Chinese report is yesterday 5,000 infected, 2 dead. That's a Chinese official version, where we believe it will be tens of lakhs of Chinese are infected every day, and thousands will be dying every day. Hospitals are overwhelmed, no oxygen, no beds. Morgues are overwhelmed, working, and there is a delays for cremation. That's a reality is happening in China.
Yes, and it's really strange, but how can they just complete? Like, for example, the latest thing that they're doing, doctor, is that they're opening up their international travel. So, and they're not even testing people. So people are traveling outside China, and recently the flight landed in Milan, and 50% of those passengers from China, and 50% of those passengers were COVID positive. So this is gross negligence. I mean, this is a time when you should at least close your international borders or restrict travel or do tests before people get onto planes and head out to different countries. It seems crazy that, in a sense, almost like they're exporting COVID.
It is a kind of negligence by the Chinese government. I would say that. The reason is when they follow the zero COVID strategy until 2 weeks ago, they had compulsory quarantining of all the incoming travelers for at least 1 week. And then they moved out of the zero COVID strategy. There's no quarantine in China. And then they're encouraging travel. They're renewing the
Yes.
passports, they're renewing the visas and opening up the borders and encouraging travel. When they're facing a massive surge, rather than restricting the travel, they are encouraging the travel. And the Chinese New Year, we know that the Chinese are going to travel into all countries and they're going to spread the virus. I won't say you have to block all the flights, that may not be the strategy, but we should be very cautious what China is doing. There's no transparency. We can always trust a country who is transparent in reporting. Absolutely no transparency in reporting. How can we believe 5,000 cases a day? How can we believe 2 deaths a day? That's unbelievable. There's no transparency, there's no reporting, no genomic testing or testing, and no reporting. Variants will emerge, variants will spread, the virus will spread. Hopefully, in India, we may not see a massive surge. That's because we have hybrid immunity. Majority of the 90% of the Indians are infected, 90% of the Indians are vaccinated. We do have hybrid immunity, and even this Chinese BF7 is a variant of the Omicron. We are exposed to the Omicron in the third wave early this year. We are exposed to the Omicron. We have got good level of hybrid immunity. Because of that, we are not expecting any big wave. We are not expecting any massive wave, but we are cautiously optimistic. We are well prepared to face any eventuality.
But doctor, we are not expecting a big wave because we don't know the variants that can come up with this kind of a situation. We are not expecting a big wave because we are assuming it's Omicron. But if there is another variant that emerges, which is deadlier, which is much more transmissible, how safe are we then?
One problem with the Chinese massive crisis of COVID is new variant may emerge that is more contagious, okay? But if a variant that is highly contagious, and the current variant is highly contagious, if a new variant that is highly contagious and very severe emerges, that will be a big trouble. And if that escapes the vaccine and existing natural immunity, and that is lethal, then we will have a difficult circumstance, not just India, across the world. Such a chance is unlikely. Such a chance is rare. Let's hope such a possibility will not happen. Such a variant will not emerge. But we should be prepared.
Why do you feel that there is a rare chance that that a variant which is deadly can emerge? Why do you feel like it's a rare chance? It's unlikely.
Virus mutate every day. New variants emerge every day, but only very few of these variants are variants of concerns or variants of significance. It's unlikely because you need a rare combination of a highly transmissible virus that is highly lethal. Delta was a very lethal virus, and we experienced that. And Omicron is less lethal but highly transmissible. Such a variant may emerge, but we believe it is less likely. This unusual combination is less likely.
So basically, we're just kind of hoping because they're not revealing their genome sequencing. In fact, I read that they have not revealed it since July of this year. So it's been about 6 months, much before what they're facing right now, when they stopped sharing genome sequencing. Why would they do something like that?
Because of there are two issues with the zero COVID strategy. One, the economic damage to the China. Yes, China is an economic giant, but 3 years of zero COVID strategy has significantly affected the Chinese economy. And number two, the rebellion by the Chinese because of the zero COVID strategy. So these two scenarios forced Xi to open up his country. He would have considered, why should I follow the zero COVID strategy when my people don't need it? When my economy is being affected, let me open up. But that let me open up was a dangerous strategy. He should have opened up. The exit should have been stepwise. He should have stepped up the healthcare facilities of China. And now there's a massive shortage of drugs in China. China has got a
Correct.
huge pharmaceutical industry. Even the Chinese mammoth pharmaceutical industry is now facing shortage of all drugs, not just COVID drugs, all drugs. So they did not stockpile drugs, COVID drugs and other drugs, including paracetamol. They did not stockpile. So with no preparation, they just, from an extremely strict policy to no strategy, complete opening up overnight with no preparation. That's a dangerous strategy that border to the negligence.
Yeah, yeah.
And
In
now
fact,
they are opening up the borders. They are just encouraging the travel. And that's dangerous to the rest of the world.
absolutely very dangerous for the rest of the world. In fact, Weibo, their Twitter, whatever platform, because they don't have Twitter in China, in that the MEA spokesperson's wife said something like, even cough syrup is not available. I mean, so, you have somebody who's part of the CCP, part of the government apparatus, speaking out like that. Of course, Weibo is heavily monitored, so they immediately kind of got rid of that tweet. But somebody who is the wife of the MEA spokesperson is publicly airing her dissatisfaction. One can just, with China, you always have to look at these signs to try and guess at what the exact situation is there. So it seems like a really desperate situation right now.
It is a desperate situation, yes, but there's a silver lining to the Chinese economy. In 3 to 6 months, most of the Chinese will be affected. Of course, millions dead, and then majority of the Chinese will be immune. Xi can open up his economy full extent. That's what Xi is planning, but that's dangerous for the Chinese public. Millions will die. That's okay, they are Chinese. His country, his policy, his people, let them face the consequences. Yeah. But opening up the border with no restriction, free travel to the rest of the world, and that is not safe for rest of the world. We faced this challenge at the beginning of the COVID pandemic. There was a delay in reporting to the WHO. China told that there is no person-to-person transmission, despite they knew that there was a person-to-person transmission. Yes, we face the consequences. The world faced the consequences. And now, rather than restricting the travel, they are encouraging the travel. But we need to look after our own safety. Yes, Indian government is screening all the passengers from China, Korea, Japan, Hong Kong, Thailand, have to undergo COVID testing, upload the COVID result on the Suvidha portal. Then only with a negative report they can travel to India. That's a safety measure. But even then, we may miss some cases. As you quoted already, half of the passengers landed in Milan from China were tested COVID positive when they did the testing in Italy. So probably if the number of cases surge, even we may have to follow a policy. Rather than just depending upon the negative report from the Chinese passenger side, we may have to consider testing when they land. Of course, we are following 2% of testing for all the passengers to come into a country and negative report prior to 72 hours of traveling. Over the time, if necessary, our government will consider additional measures, and I'm sure we will, based on the circumstances, we'll be thinking about additional measures.
Hmm. And this sort of situation wherein we don't know what they're up to. Even the WHO is not an organization that China seems to take very seriously. Dr. Ted did say that there is concern, but beyond that, even he's not able to say anything because China doesn't play by the rules of global decency and etiquette and being a citizen of the world. I mean, like a part of the community of nations. They just don't believe in that.
No, China doesn't play by the global rules, and we saw that in the beginning of the pandemic in 2020. Now, there is a Lancet Commission. I should not quote my personal opinion. There's a Lancet Commission on the COVID. It's written by dozens of experts, from global experts, and they have very categorically stated there was a delay from the Chinese side in reporting the transmissibility or contagiousness of the virus in the beginning of the pandemic, and there was a delay from the side of WHO in accepting that it could be airborne or even the role of mask. But of course, see, these things have happened. I will not blame WHO. Probably WHO was not powerful to intervene at that stage. We should understand the limitations of global organization when dealing with powerful countries. But of course, the world face the consequences. We should not have such a situation again. We should be careful. I will not say we have to cancel the flights from China. That's all extreme measures. We don't need that for the time being, but we should be vigilant and we should be willing to step up the measures based on the emerging circumstances, emerging number of the cases, and based on the variants that emerge.
Doctor, there is a lot of talk about this variant B47, I think it's called, which was detected in India and Odisha, I think one case about 4 and 6 months ago. And that they say is very prevalent in the China surge right now. How concerned should we be about this variant? Is it different from Omicron? What is the story with this variant?
This variant is BF7. Now, BF7
BF.
is a subvariant of Omicron. Omicron has a variant called as BA5. That's a variant. BF7 is a subvariant, and that's what is spreading in China. Not just in China. 5 to 10% of the COVID cases in countries like UK, US are BF7. It's not rare. It's already spreading across the world. Even India has identified 4 cases of BF7 way back in July. 3 cases in Gujarat and later 1 case in Odisha. And they were all mild cases. Some of them did not even have symptoms and were very mild cases. And luckily, it hasn't spread. So that's a good news that we did not have more number of cases of BF7, but we should be vigilant. We are stepping up the genomic sequencing of the isolates that we identify in India. And India, the Union Health Ministry has instructed all the states to step up the genomic sequencing to send maximum number of isolates for genomic sequencing so that if we can identify the trend of BF7, and more than that, if any new virulent variant emerges out of this, we can immediately identify. So far in India, there are only 4 cases of BF7. That's a good news, but we should be vigilant. And 2 days ago, as per the instruction of the Union Health Ministry, all the states conducted a mock drill. All the hospitals in the country, they audited their facilities, the COVID bed numbers, the ICU numbers, all oxygen facilities. So and the government is happy that our country is prepared to face even if a large wave happens, but such a wave is very, very unlikely.
And so, what are the precautions that we can take at this point of time, like ordinary citizens?
Yes, government is doing what governments can, but as citizens, we have a responsibility. That is masking. Probably this is a time we need to go back to the masking again. Of course, the mask mandate always lasted, but the public stopped wearing the mask, especially even in crowded places. So at least in crowded places, in congested rooms where there are too many people, wear mask. Follow social distancing, at least in such places. And you step up the hand washing again. We all know the importance of hand hygiene. Step up the hand hygiene, follow social distancing as much as you can, and restart wearing mask, especially in crowded places. And if you are a person above 65 years, heart disease, lung disease, asthma, cancer, please take the precautionary dose of vaccine that the government is distributing if you haven't taken already. Vaccines play a good role. So countries like America is giving even the fourth dose of vaccine. We are not recommending that. Majority of the Indians have taken 2 doses of vaccine, but there's a lot of people who haven't taken the precautionary dose. I'm not recommending precautionary dose. We are not recommending precautionary dose for young or healthy. We are recommending the precautionary dose for elderly and those with other medical conditions. Those who haven't taken, such individual, if you haven't taken the precautionary dose of the vaccine, please take the precautionary dose of the vaccine.
Doctor, how seriously should we take this whole conversation about the vaccine causing, other ailments? And like it's going on a lot in America, for example, where the anti-vaxxers, and now with Elon Musk lifting all those restrictions on Twitter, you have a lot of the doctors who are vaccine coming online and saying that, look, we told you so. Why are young people suddenly dropping dead? And it's because of the vaccine. So there's this, I'm talking about just general public. There is a little bit of a buzz about this. How concerned should we be? Are our vaccines different from Pfizer and in terms of their technology? Where do we stand on this?
A very interesting question. See, vaccines are medicines. Even if you take distilled water and inject into your muscle, you can have side effects. You may have side effects. And vaccines are medicines. No vaccine or no drug for that matter. Take a case of paracetamol. Paracetamol have side effects. If you take 20 tablets of paracetamol, you lose your liver and you will die. We are talking about paracetamol. I'm talking of distilled water. And vaccines are medicines. And medicines may have side effects. But the advantage of taking a vaccine and preventing a serious COVID, especially in individuals with other medical conditions, the advantage of getting vaccinated far outweigh the risk of side effects. The chance of you developing a serious side effect is far lower than you getting a serious COVID or dying of the COVID. Yes, vaccines can have side effects. At the same time, the problem is we have got one end, we have got blind anti-vax people. They are against all vaccines. They are against COVID vaccine. They tell the public, don't take the vaccine. Such anti-vax people are dangerous. On the other side, there are people who don't even want to discuss the side effect of vaccine. That's also dangerous. We need people who encourage rational usage of vaccine. We need people who encourage the public to get vaccinated, at the same time are open about the discussions of side effects of vaccine. That's what we need. Rational usage of vaccine, who encourage vaccination, at the same time willing to open about the side effect of any vaccine. That's what we need.
I'm just trying to understand this. Now we have this nasal vaccine also that is going to be available. How effective, doctor, is it compared to the injectable vaccine that we've all taken?
The Bharat Biotech has got a license for nasal vaccine. The data provided, the available data by Bharat Biotech says that it's a good effective vaccine, but we are yet to see the large scale published data. Let's hope we are going to get a lot of published data. But what Bharat Biotech's available data claims that it's got good immunogenicity, they have done good quality clinical trials, but let's wait for large scale published data. But I am willing to take the nasal vaccine. If I'm take a precautionary dose, I'm willing to take that nasal vaccine. So I trust, because we had a problem earlier, with the published data of the Covaxin, and later we knew that Covaxin is an effective vaccine. Effective vaccine, and a good portion of our population was vaccinated. I took the Covaxin, and when the Covaxin was introduced, and Covaxin is a good vaccine. The Covishield is a good vaccine, and we have got now the protein vaccines in the country. We have got the DNA vaccine in the country, and now we have got the nasal vaccines. All of them are good vaccines. Some vaccines may be better than other vaccines in certain aspects. Some vaccines may not be better than the other vaccine in certain other components. So there are plus and minus aspects of all these vaccines, but all these vaccines are good vaccines. I encourage you to get vaccinated. All of them are good vaccines. Indian government will not license a vaccine unless we are convinced about the efficacy and side effects of the vaccine.
And also, doctor, this nasal vaccine, would it be something that we can self-administer? Sounds like nose drops to me, but or will it be something you'll take with a doctor?
Yeah, you need to go to the vaccination center. Currently, we are not encouraging buying. It will not be available in pharmacies for you to put 4 drops here and 4 drops there. You need to go to a vaccination center. It's a vaccine.
Okay.
Yeah,
Okay.
it looks like an nasal spray, yeah, but
Yeah.
you need to go to a vaccination center.
And yes, there's a question from one of our viewers. He wants to know, does the booster dose need to be the same as the earlier 2 doses, or what can one get whatever's available?
Yeah, you can take, for example, when the nasal vaccine was licensed and government has advised, you can take it as a booster dose. So if you are taken a Covaxin or a Covishield earlier, if you want a precautionary dose, it can be the nasal vaccine. It doesn't have to be the same dose.
And doctor, we've spoken about the elderly. What about children? Children under the age of 5, for example. How safe are they? And anything in particular that one needs to watch out for them?
This nasal vaccine is licensed for people above 18 years of age, for adults. It's not at license for it's not recommended for children. And even otherwise in children, we are not giving the vaccine anyway. Small kids, we are not recommending the vaccines, and we are not giving the booster dose of the vaccine for children anyway. We only recommend the booster dose for adults with risk factors.
Okay, interesting, because in America, they are giving kids the vaccine also in the US.
America, they are giving even for the small babies are vaccinated. And I don't think it's necessary, because the chance of your kid having a complication with COVID is not that high. And if of course, our government, our NATAGI, the vaccination committee, will be looking into all the aspects. And if our government recommends that young kids should be vaccinated, at that time, we can consider vaccinating our children. But I don't think our NATAGI has got any plan of recommending vaccines to small babies.
And the other worst case scenario that runs around in one's mind, layperson's mind, is that will we ever go back to April 2020, where we shut down and we lock down and we're all in our homes? Do you think that scenario can ever repeat itself with the pandemic?
We have almost, no, I don't think we are going for a lockdown. Even if a new wave, we will not go for the lockdown. Omicron was a massive wave. Omicron wave was even larger than the deadly Delta wave. And Omicron, probably in some state, there was a very brief lockdown for a week or two. But I work in a cancer hospital. Majority of my patients are cancer. I witnessed the massacre of the first wave and the real massacre of second wave. But the Omicron wave, the third wave, we didn't really even feel that it came and went. And after that, we went back to a normal life as if COVID is not there. But the new Chinese, what's happening in China, Japan, and US and Brazil, it may be a reminder that everything is not back to normal. We should be careful. Yes, we can live a near normal life, but we should be vigilant. We should be watchful. And when the number of cases increases, we have to follow the precautions again. But it's extremely unlikely we will go for any lockdown. What we witnessed in 2020 is we will not be witnessing again.
In Germany, the epidemiologist, the top leading epidemiologist there, has said that we have almost on the verge of moving from pandemic to endemic stage. Can you explain what is a pandemic and what is endemic, and whether in India we are at that point also?
Now, all the public knows the pandemic, what a pandemic is and what endemicity is. What we experience in 2020 and 2021, early 2021, was the pandemic. And after that, majority of we got infected, we got vaccinated, we developed good amount of immunity, and we opened up. And even after opening, even now it's endemic in India. The number of cases yesterday, we had only 280 cases positivity. That's called as endemic. If you get lakhs, that's pandemic. You get few hundreds in a large country like India, that's called as endemicity. And we know that we are back to nearly back to normal life with a few hundred cases in the country. That is a typical example of endemicity. And now, by any chance, if the number increases again to 50,000 or 100,000, again, that will be a big wave. We'll go to the waves of, again, waves. So the endemicity, the situation can change, the number can increase again. And that's again a stage of endemicity. We should expect small waves and rarely large waves. That's how any disease is.
And doctor, this is my final question, because we have a lot of people who have a very cavalier attitude, and you meet them and they say, "Arey, mujhe to COVID 3 बारी हो गया, 5 बारी हो गया." They'll say that to you. But I want you to share with people, there are people who suffer from long COVID and have a lot of symptoms even after testing negative for months. Some people have had it for a year, 2 years. So it's not that, COVID comes and goes. It can leave you with a variety of symptoms. So people should not be that casual about even, contracting COVID.
Yeah, even if you get, I know people who got all the three variants of the COVID. First wave, second wave, third wave, they got infected. And they are vaccinated twice and even the precautionary dose of vaccine. So even if you're infected 3 times, even if you're vaccinated 3 doses of vaccine, you may still get Omicron. If you are very healthy, young, yeah, it may not kill you. You may not get any severe disease. You make it. Nobody can guarantee that. But chance of you getting a very severe disease and dying is less likely if you're young, healthy, previously infected and vaccinated. But that's not the scenario if you're elderly or any other risk factors. Even if you're vaccinated, even if you had a precautionary dose, still you need to be careful. Wear a mask, follow social distancing, and those who are not vaccinated, vaccinate. And if by any chance the number of cases increase in the country, we have to avoid big get-togethers. And for the time being, we don't have such a scenario. And as per our government, we will know the situation after 30 days. Because our previous experience, whenever there's a surge happened in other Asian countries, the Indian surge was after 35 to 40 days. That's why, according to Indian government, we need to wait for 30 to 40 days to know what's going to happen. So after a month, by mid-January, we will know the real scenario. But again, we are not expecting any massive wave. Such a massive wave is very unlikely, but we should be vigilant.
Doctor, what Rashmi is asking, any idea of what the efficacy of the nasal vaccine is? How many months will the effect last?
I don't know. I'm still waiting for the published data.
Okay. And this is an important thing that you've just said. I want to repeat it for our viewers, that wait till, I think it's only by about mid-January when we'll get a clearer picture on whether we are going to hit a wave or we're going to carry on as we are right now, and we're going to stick to the 200 odd cases a day being reported, when it comes to COVID. So I think time is the only thing. So be safe this new year. If you're going to any heavy duty parties, try and wear a mask, as inconvenient as that will be. And really, I mean, that's the only thing, really. Precaution is better than cure, as they say.
Oh, yeah, I completely agree. Precaution is better than cure, because COVID, at least those people who had got bad COVID will know how bad it was. Those people who lost family members know the disastrous consequences of COVID. At the same time, we now know how to live with the COVID virus. We know how not to be panicky. We know how to be vigilant. We need to be vigilant, but not panicky.
Thank you so much, Doctor, for joining us on this quick chat. Hopefully, we won't have to discuss this again within the next month. Yeah. I'm hoping, because every time we meet, we're always discussing COVID for the last 3 years now. So hopefully, we'll have something else to discuss. And thank you so much for sparing the time. I want to thank our viewers for watching. Very important conversation, and be safe and stay safe. Take care.
Thank you.
Bye. Thank you.